Hello everyone, you are welcome to SSB Pharma Learning Channel, YouTube channel. I Dr. Shamsher Singh today going to discuss with you about GPAT question series, and in this GPAT question series always we discuss about the new tricks which will be useful for the GPAT exam, and the tricks and the question in this series are: the first trick is asthma attack acute management. So how you manage the asthma attack? So you can remember it by code word which is a online chart. So what does it mean? Online: O indicate oxygen, S indicate salbutamol, H indicate hydrocortisone, I indicate ipratropium bromide, R indicate roflumilast, and T indicate theophylline. So this drug, like you know that oxygen is required in asthma, because of oxygen deficiency this happen. Salbutamol, which is a stimulant, which is very useful and dilator. Hydrocortisone and ipratropium bromide, these are the steroids which are useful as an anti-inflammatory, inhibit COX-LOX mechanism. And roflumilast is a PDE4 inhibit, thereby increase the level of CAMP and is very useful in asthma. And theophylline is a direct bronchial smooth muscle stimulant, which also increase the level of CAMP by GPCR mechanism. So this is a short form which you can remember for this treatment or management of the acute asthma. The next question is drug with largest volume of distribution is. So options are amoxicillin, warfarin, ampicillin, and chloroquine. So you choose the right answer for this question. That means the drug with a wide volume of distribution in the body after taking. So the right answer is chloroquine. So you know that chloroquine, which was also preferred in case of COVID, and this chloroquine is having a largest volume of distribution, that is more than 1000 liter per kg. So other drugs like amoxicillin, warfarin, they lie around 80 to 200 so liter per kg. So this is the volume of distribution of the drug in the body, in the blood and tissues. So the right option for this question is a chloroquine. Next question is, which one of the following drug act by inhibiting DNA replication? The options are 6-mercaptopurine, actinomycin D, mitomycin C, and asparaginase. So you choose the right answer, which is a DNA replication inhibitor and inhibit the cell replication. The right answer is 6-mercaptopurine. So this 6-mercaptopurine, you know that it is a well-known drug to be used for in case of cancer in melanoma, and in that particular case it act by inhibiting the DNA replication and inhibit the DNA growth, cellular growth. So this is the right answer for this question. The next question is mechanism of resistance to penicillin via beta lactamases. The options are altered penicillin binding protein, drug efflux, breaks drug structure, alteration in 50S ribosomal structure. So you choose the right answer, that how lactamase secreting bacteria are resistant to penicillin, that are basically gram negative bacteria. So the right option is they break the structure of penicillin. So you know that lactamase enzyme break the penicillin structure from the lactone ring, and by degrading penicillin structure, these lactamase enzymes secreted by gram negative bacteria, they cause breakdown of the penicillin, and this is the reason for the resistance in that particular bacteria. So the next question is pegloticase is used for the treatment of. Options are ankylosing spondylitis, CPPD, chronic tophaceous gout, and refractory rheumatoid arthritis. So you choose the right answer for pegloticase drug. So the right answer for this drug is chronic tophaceous gout. So you know that gout, which is a problem with the pain in the joints. The second thing, it occurred due to the excessive accumulation of uric acid. The reason behind this is a uric acid and your pH of the joint is basic in nature. So that's why due to acidic nature of acid, it goes toward the basic nature of your synovial joints and start to accumulate inside the joints. So due to this accumulation, they destroy the cartilage and then responsible for the pain. However, this pegloticase, it is used for the tophaceous ghost. That means where the tophies are formed. So tophies mean these are the small nodule-like structures which are formed around the joint. So that's why this drug is used for the treatment of chronic tophaceous gout. The next question is, which one of the following is not a prokinetic agent? Options are 5-HT4 agonist, D2 blocker, motilite, and diphenoxymethane. You choose the right answer for which is not a prokinetic agent. The right answer for this question is diphenoxymethane. So you know that the other drugs like 5-HT4 agonist, D2 blocker, motilite, they are a prokinetic, mean they increase the gastric motility and useful in case of, you know, and that whenever there is a diarrhea like condition, there is a constipation like condition. So this diphenoxymethane is not under the category of this agent. So this is the particular answer which is not a prokinetic agent. So this is a new trick which is useful for you all. Potassium sparing diuretic. You remember it by the name of paste. So any paste you can use the short word for this. P indicate potassium sparing diuretic. A indicate amiloride. S indicates spironolactone. T indicate trimetrine, and E indicate eplerenone. So these are the drugs, you know, which are used as a potassium sparing diuretic, and they are useful to spare the potassium, because you know that these potassium sparing diuretic are useful in case of hypertension and they are useful in case of cardiovascular problems where the CHF, congestive heart failure, is caused by lacking of oxygen and there is an increase in the preload over the heart side. So this is the condition where you know that we want to use spironolactone, which is a one of the drug which act on the nuclear receptor in the body. Amiloride is a sodium channel blocker, and these are the drugs which are used as a potassium sparing diuretics. Next question is fluoroquinolone contraindicated in liver disease. The options are levofloxacin, pfloxacin, ofloxacin, and lomifloxacin. So you choose the right answer or comment in the box which is contraindicated in the liver problems. The right option is pfloxacin. So the few of the reasons are there that pfloxacin is having a short T half. First thing. Second thing, it is metabolized by the liver and produce hepatotoxicity. So it is toxic to the liver cells. So pfloxacin is not preferred instead of levofloxacin, lomi, and ofloxacin. They are useful drug against gram-negative and gram-positive type of bacteria. So this is the right answer for this question. Next question is, which is true about non-competitive enzyme inhibition? The options are Km remains same, V max decreases. Km increases, V max remains same. Km decreases, V max increases. Km increases, V max increases. You choose the right answer, which is a non-competitive enzyme inhibition. So the right option for this particular non-competitive enzyme inhibition is Km remains same, Vm decreases. So what it means? The rate of reaction is remains same, but the maximum volume Vmax is decreased. So in this case, you know that atropine and some other drugs, these are a not a competitive at all in all the receptors, you know, for the cholinergic receptor. And even though this Km remains same, Vmax decreases, it also happen in case of, you know, alcohol and some other agents. So this is the non-competitive enzyme inhibition, where this is a right statement. Km is same, velocity rate of the reaction remains same, the Vmax will be decreased. The next question is theophylline causes diuresis because of PDE4 inhibition, adenosine A1 receptor antagonism, beta 2 agonism, or PDE3 inhibition. So you choose the right answer for this question. How theophylline causes diuresis? The right option is adenosine A1 receptor antagonism. So you know that adenosine A1 receptor antagonism, they are responsible for the muscle relaxation, and particularly you know that whenever the muscle will be relaxed for the urinary sphincter or some other cases, and even though the second mechanism for A1 receptor is they increase the water expulsion toward the extracellular area from the intracellular area. So that's why, due to the movement of water from the intracellular to the extracellular side, they increase the, you know, fluid pressure over the Bowman capsule, and thereby they are responsible, not complete they increase the urinary secretion, but they are a, you know, moderate and very slightly acting diuretic agents. So that's why, due to the stimulant property and the muscle relaxant property of this drug, they little bit act on the adenosine A1 receptor, and thereby responsible for the this diuresis, increase in the urine output. And even though you know that this is also in case of caffeine, coffee, once you take it increase the urine output. And in the third mechanism for this is they increase the level of porine channels. So suppose these are your ureters, so they increase the level of porine channels. So what they do, the porine channel increase the water influx toward the urinary site, so that the water can be expelled out or it can undergo diuresis. So this is the right answer for this question. Next question is drug of choice for invasive aspergillosis is posaconazole, voriconazole, liposomal amphotericin B, and casfofungin. Now, what is the right answer? You choose the right option for this question. That whenever there is a invasive inner infections which are caused by aspergillosis, aspergillus type of the organism, the right answer is this voriconazole is a drug of choice for this, because it cause direct cytal effect and killing of these organisms and inhibit the growth of these organisms. So this is the right option for this particular question. The next question is which one of the following drug act by inhibiting RNA synthesis? The options are rifampicin, nitrofurantoin, ciprofloxacin, and novobiocin. So you choose the right option or comment in the box. The right option for this is rifampicin. So you know that rifampicin inhibit the RNA synthesis, thereby inhibit the mRNA dependent protein synthesis, and thereby inhibited the cellular growth. So rifampicin, which is an anti-TB drug, which is a class 1 drug, and it is useful to kill the bacteria and basically affecting the gram negative type of the bacteria. That's why the exact mechanism which is here, it inhibits the RNA dependent, mRNA dependent protein synthesis and cellular replication. So this is the next trick which is new for you all. Serotonin syndrome components are, you remember it by the name of harm, that is excessive serotonin is also harmful, which is called as a serotonin syndrome, and some drugs cause serotonin syndrome. So how you remember it? Serotonin syndrome components are H. Hyperthermia, there will be increased body temperature, autonomic instability, delirium will be there, excessive thought will be there, and delirium in this case excessive thought which are followed by the relaxation of this mental ability, and R indicate rigidity of the muscle, and M indicate myoclonus, little bit twitching are there. So you know that in case of serotonin syndrome, whenever you take a higher dose of some of the drug, or due to some metal toxicity like manganese or some other agents, so they are responsible for the serotonin syndrome. So that's why harm can be useful to find out what are the symptoms of the serotonin syndrome, and this you can remember it well. Hope these questions was very useful in this GPAT series for you all, and in the coming lecture I will discuss more about the GPAT questions as well as some other topics from the basic pharmacology, so that will be very useful for you all. You like, watch and subscribe the channel, you are welcome. Thank you very much.